doctor's mic. I am sounding now, doctor's mic. Anytime soon, we will tell you what to do in case we cannot attend to you or doctor cannot attend to you here. We'll tell you how to get him. But for now, let's get talking. Dr. Adeogun, good to have you join us in the studio this morning.
Good morning, sir. Nice to be here.
Nice to be here. You were talking about the road from Ajah to Ikeja to this place. I don't know, how is it like this morning? You know, it rained so much this morning. Is it this morning or last night? Thereabout. You know, it rained. I don't know. What's your experience like?
Well, as usual, it's quite challenging sometimes to move around Lagos because there's usually traffic. You have to leave your house early ahead of wherever you are headed to. But whenever it rains, you just know that you have to probably be an hour, ahead of your usual time because you're going to probably envisage that there'll be traffic. But it was fair enough. At least it still took me well over an hour to get to
Wow.
Ikeja.
Okay, let's get talking now. First of all, we'll start with dementia, and then we'll proceed gradually to mental health. Doctor was actually trying to narrate to tell me something, outside the studio, what a couple of persons are actually facing or passing through as regards dementia, and I feel we should talk about it, just as we would love to watch our health. But for some persons who really don't understand what dementia is like or means, he would help us break it down. He will help us understand and why you think you should watch out for it. You should do everything to be far from it. Talk to us about it, doctor.
Thank you. Dementia is a condition that we refer to as a neurological condition because it typically affects the brain, and it presents as loss of memory. It presents as disorientation or confusion, and it also has a genetic basis, meaning that it can run in families. And typically, dementia is something that people associate with aging. There are different types of dementia, but the most common one is the Alzheimer's disease. The one
What do you call that?
Alzheimer's.
Okay.
Alzheimer's disease
Okay.
or Alzheimer's dementia. So it's that type of dementia that typically is associated with the aging process. So typically it's for the seniors, people well advanced in age that typically develop it. And Alzheimer's, being the most common type of dementia, typically presents as deposits in the brain. There are certain deposits that are found in the brain. There are some medical terms to explain them. We call them plaques.
Okay.
Sometimes they are called senile plaques or beta amyloid proteins, deposited on the brain, in the brain. And this affects the rate at which transmission of signals, across the neurons that help to fire activities in the brain. Everything gets hindered, and then you can now see the patients manifesting symptoms of memory loss. And the memory loss, is of different severity. Some people can forget some basic stuff about themselves that you expect them not to forget normally, like your birthday, your name, the number of children you have, your home address, and all that. So simple things like that, it now becomes worrisome. That these are things that
Forget yourself, almost
Yeah,
everything.
almost vital information about yourself that normally if you are woken up in the middle of the night and they just ask you what month were you born, it's something that you should even say even in your sleep without thinking. But you find out people cannot actually articulate these things because their memory is really declining. Apart from memory decline, they can now have cognitive decline, meaning that the ability to analyze, the capacity to have straight thought patterns or be able to communicate effectively now becomes a problem. Sometimes they know exactly what they want to say in their minds, but for them to actually articulate it and pass across the message becomes a problem. And it can be very frustrating because you can imagine somebody who has been a normal person all their lives, and at a certain point in their lives, they now find it difficult to communicate, or they find themselves confused,
Okay.
and they really can't be well oriented. And this is a source of worry to both the patient and their relatives. And this is a trend that we're beginning to see a lot now, more than before. And a lot of people don't seem to understand it. And when this happens, it causes a lot of friction within the family, within the household, or between the patient and the caregivers, because everybody is impatient. How would you forget this? How would you forget that? But we told you this. The person can ask the same question several times a day, forgetting that he had already asked previously, and they kept telling him the same answer. Person can still ask again in an hour's time, exactly the same question, and you answer correctly, and the person will still ask you again, meaning that the memory capacity has really nosedived, and there's a major sharp decline in that. And for people that have this, if they don't have understanding family members or caregivers, it may lead to neglect, because everybody is busy in their lives too, especially the younger folks that are staying with aged parents or aged people. I've told you, I've answered your question once. Why are you asking repeatedly? I don't have time for repetition. But this is an avenue for people to understand that this is a true condition. Those elderly people are not just trying to be problematic, but it is a true condition that requires a lot of love, emotional support, and understanding. There are some medications that we can give to slow the progression. We must be clear that dementia is a progressive disease. It's a neurodegenerative disease, meaning that things gradually nosedive, but you can slow down the progression so that it's not as rapid. So it's not a free fall of the neurological function. And for some people, it progresses to the point that they may even become bedridden. So it's a condition that once you initially notice those early signs, swing into action. We always say that early detection, early intervention would always create better outcomes. So by the time you are starting your medications on time, you change your diet, a lot of family support, a lot of love around the person, it can slow down the progression of the disease. And a lot of people are now beginning to have it at younger ages. They don't get to that elderly age bracket before signs and symptoms of this start happening. So there are lots of other risk factors that puts people at risk of dementia. You can run in your families, but your lifestyle also, to a large extent, may also determine the progression of the disease. So if you have any family member, any first degree relation that is directly related to you with the condition, then your alarms should be ringing, and you should also watch out for whatever are the risk factors you also carry based on your lifestyle or your diet, and you adjust accordingly. The specialist to see is a neurologist. A neurologist helps to assess the dementia, the type of dementia, and the best suitable treatment plan for the patient. So there are some drugs that are available that we normally give, and there are some supplements too that may also help to assist to slow down the progression. And there are other activities too that we tell people: when you keep active as an elderly individual, if you are for instance retired, you don't say because you are retired you don't do any activities again. You should stay active. Stay active physically, stay active mentally, stay active in terms of reading. You can read the newspapers, you can read magazines, you can read your Bible, you can read texts that are useful to you. Engage in mentally stimulating conversations. And if you need to calm down, get some good music, meditate. All those things keep your mind alert and keeps your mind active. And for people who have problems sleeping, or people who have not who have had a very hectic schedule and they've not really had a downtime, you should find a time to rest and shut down, because the quality of your sleep affects your memory. If you have poor sleeping habits, you may start having loss of concentration, loss of focus, or loss of memory. It's very important that the quality of sleep is what we should pay attention to. Because a lot of people in Lagos, for instance, don't sleep well. They don't sleep enough. You leave your home early, you come back late, you are active throughout the day, you don't take a nap during the day, and at night you are just immediately the alarm buzzes, you are out again. So a lot of people still work weekends, some even work on public holidays and all that. So we need to have a healthy work-life balance. so that we minimize our chances.
When you
of-
mention Lagos, I always almost want to mention mental health.
Yes.
You know, and that's the second thing I mentioned. I wanted to just touch on a little, because
Yeah, it's a lot.
just talk to us.
Yes, it's a lot. Mental health.
Mental health.
Yes.
Yeah.
The World Health Organization defines health as a state of complete physical, mental, social, and emotional well-being. Those four must be complete. So a person may look good physically, all muscular and tall and all that, but is not mentally stable or mentally healthy. That cannot be regarded as a healthy person.
Okay.
The person who is not socially healthy, cannot maintain good relationship with others, has antisocial behaviors, is not a healthy person. Person who is not healthy emotionally is not a healthy person. So mental health is that part of us that affects the way we think, the way we behave, the way we perceive the world and people around us, and it affects our health to a great extent, more than we realize. And mental health, is strongly associated with our emotions, how we feel, and how things around us affect us, and how we also interact with our environment. So a lot of people around us, for reasons we know, are going through a lot of stress. We have a lot of stressors around us. We have the economic stress, we have physical stress, we have emotional stress, we have anxiety disorders. So when you talk of mental health, a number of things affect our mental health. Even anxiety is a mental health issue of concern. You are uncertain about the future, you're uncertain whether the business you're investing in will thrive, you are worried about your job, you are worried about traffic, you are worried about what tomorrow holds, you don't know what to expect next. All those things affect our health. You see people who are anxious, they can barely relax because they are always in that mode of being overdrive. They are nervous, they are sweaty, they are palpitating, heart is always racing fast, like they are running a race. They may be breathing faster than usual. All these have a mental origin. And if you do not address the cause of the anxiety, it will be difficult to manage the symptoms the person presents with. Some people have phobias. When they get in certain situations or circumstances, they react in a certain way.
A certain way.
Yeah, so based on the phobias they have, it can also arouse anxiety feelings. So anxiety is a big deal that a lot of people are going through. It is possible for you to curb your anxiety through meditation, good sleep, relaxation techniques, going to see a psychotherapy. And I want to emphasize here that seeking mental health care, a professional, doesn't necessarily translate to a person being a psychiatric patient, because we have a lot of stigma associated with mental health issues. A lot of Nigerians deny themselves of seeking professional help due to stigma or judgment.
Okay.
They don't want people to see them as maybe they've gone round the bend or they've lost their minds and all that. So mental health is as important as your physical health. So as you're taking care of your physical health, you must also make sure that you are on point regarding your mental health as well. For a lot of people, apart from the anxiety disorder, we have some people that it is their lifestyle that has actually channeled them to have mental health problems. Substance abuse, alcoholism, abuse of recreational drugs. You have the marijuana, you have the amphetamines, you have the codeine and all the other heroin and all the other drugs that affect a person's they are psychoactive substances that affect a person's mental state and can even be hallucinogens. A person is seeing what is not there, is hearing what is not there, can smell what is not there, can feel things crawling all over their bodies. Yes. So hallucination is a type of sensation that you feel, or that's not the right word. Hallucination is you having that, like all your five senses can actually feel a certain stimulus that is not there, that other people in the same environment would not experience the same. So certain hallucinogens are things that people also abuse, that they get addicted to. So your lifestyle, what recreational drugs you indulge in or you're addicted to can also, give rise to mental health disorders. Then most especially we talk about depression. I always talk about depression because you cannot talk of mental health issues and not emphasize on clinical depression. depression is a state of low mood, lethargy. You don't have strength to do anything. You are not motivated to do anything. Even to get out of bed can be an issue. And for a lot of people, they may even have this outburst of emotions and crying spells, crying unprovoked. And nobody can really understand, what is going on. But really, if such people are found, they should actually seek help. Professional help will help you dig deep into what the source of the problem is. For some people, their depression is because they've been bereaved recently. For some people, it's because of the loss of a job or a divorce or hardship, or it could even be relationship issues. But the important thing is, once you notice that your mood is perpetually low, you are lethargic, you are sleeping too much or sleeping too little, you are eating too little or eating too much, or you have suicidal tendencies, those are the things that are indicators. They are red flags indicating that a person may be depressed. And this is not only for you to watch out as an individual. You should also watch out for it in other people around you. Because unfortunately, most of the cases of suicide we hear about started with depression that was not picked up early. It went undetected until eventually the person had to, take their lives because they didn't get the help they needed. There's this sense of worthlessness, hopelessness, despair that comes with untreated depression. So we should look out for these symptoms. Somebody around you who is normally an extrovert, a lively person, a happy person, and suddenly this person is socially withdrawn, doesn't want to engage with other people, doesn't want to engage in activities they usually enjoyed. The things they previously enjoyed, maybe football, sports, or music, they are not interested in those things anymore, and they just want to be alone, and they are always in a low mood. If these symptoms persist, please make the person seek help. Because in the extreme case, it leads to suicidal tendencies. And a lot of people, once they've tried to attempt suicide once, and maybe they got deterred from doing that, or they were saved from doing that, trust me, there is always a possibility of it reoccurring.
Wow. Okay.
And once it reoccurs the second time, the person plans it in a better way because they make sure they are successful on the second attempt. So please, let's be our brother's keeper with regard to
But I understand, I know, but then Nigerians are not quick to go into the hospital for normal checkup until we are down. To an extent, you can't even move your legs or your head or your hands or your body. That's when you remember, the hospital, the doctor, this and that. But I want to know why it is like that in this part of the world. People don't approach hospitals. People don't meet doctors except there is a critical condition. Why?
The only reason why I think that happens is we always want the easy way out. So we think, why would I go to the hospital and spend a lot of money to see a doctor, and the doctor will have to write me tests, write me prescriptions, I'll pay for consultation, I'll still pay for tests, and they would ask me to come back for follow-up and all that. But I still woke up myself this morning, I drove myself to work, I'm still eating, I can still do my routine activities. So why would I go and waste money? To them, they think it's a waste of money, and some of them assume, they falsely assume that because you seem functional externally means that you're actually fine medically. That is very false. There are lots of illnesses, very serious illnesses that are potentially fatal, that show no signs or symptoms until the advanced stages. So how would you know you have them if you don't check for them? So it's a bit, permits me to use penny wise and pound foolish situation, because you're trying to save money, but at the end of the day, when these real complications arise, they are not going to be cheap. The management is not going to be cheap. It's not going to be cheap in terms of finances, and it's not going to be cheap in terms of what it will take away from you as a person.
Yeah, I understand.
And then it will cut you off from all your activities, and every other thing you think you're doing, you won't be able to attend to those things. So at the end of the day, what you're going to pay will be far more than what you would have paid if you had gone for frequent checks. For instance, high blood pressure, we keep telling people, don't wait for any symptom, because you're not going to find any. It is asymptomatic. You'll feel normal, you'll wake up normal, you can jump, you can jog, you can do everything you want to do, but your BP is explosive already. So a lot of people in Nigeria think they're saving money or they are trying to be, frugal with spending.
Yeah.
When it comes to health. But I really don't know what you're keeping your money for, if not for your health. Because without your health, nothing works. Your plans, your dreams, your aspiration will come to nothing if you don't have good health. Even all the money that you work for, that you have saved up in the bank, a terrible illness can wipe it all off. Illnesses are one of those things that can make you financially bankrupt in no time. So why would you want to put yourself in that situation? Everything you've worked for, all your savings can just be gone, from a health challenge. So it's very important that while we think we are healthy or living healthy, we should always be on top of our game to do a checkup, because it's always in your best interest to be assessed and evaluated by a doctor, and making sure that you know what your health status is at any point in time. And if any illness is found out or detected in your examination and your assessment, please make sure you are following the right treatment regimen, and whatever recommendation or lifestyle changes the doctors have recommended, it is in your best interest to stick or adhere to those things. Because at the end of the day, complications are impossible. If it happens, if you know people that are on dialysis, that have to do dialysis 3 times a week, it is not cheap. People that have to do a renal transplant, you can empty your whole bank account for that, and you'll still be seeking for help because the money is not even still enough, for those things. So Nigerians should please take it as a responsibility, and should be prioritized that your health and health care must supersede every other thing, because every other thing is secondary. Because it's only when you are healthy you can continue with your work and your business or revenue generation and all that. So it's essential that we go for regular health checks.
Thank you so much. Thank you. I love the way you were putting it straight up, and one could easily understand. But aside that, someone is asking a very vital question here. I asked you, everyone, to send me a message. In case you want to ask a doctor a question, just send a message to 081 717 56338. Now, her name is Madam Florence. She said, please, when is the best time to take blood pressure pills? Is it morning or night?
Good question, because this has always come up at every point in time. For a lot of people, actually, what is important for you to do is make sure you take your blood pressure medications. Because in the morning, you have what we call a cortisol surge, the cortisol hormone that rises, just in the early hours of the morning, and peaks around 8 a.m. in the morning. And that shoots your blood pressure up. So likely, most people may have their blood pressure high in the morning, and then till around 8 or 9, and then it normalizes, or comes down, after that time. So a lot of people may take their blood pressure at night for that reason, because they don't want that spike in the morning. But for a lot of people too that have a lot of activities during the day, the main stressors that they experience, is during the day. It is during the day that they find things that would really push them to have elevated blood pressure higher than when they are asleep and all that. For those kind of people, they can take it in the mornings during the day too. So for me, I say it's a relative thing. I think depending on your peculiar situation, you can discuss with your doctor what is best for you, and based on your routine or the quality of your sleep. If you're someone that sleeps well and your sleep is so sound, undisturbed, undisrupted sleep, I think you can take your BP in the mornings. But for those that know that they have problems with that, they can discuss with their physician on what time is best for them. But typically, you must take your blood pressure pill, whether it's morning or night. Make sure you don't skip it, and make sure that you adhere to it, and it's a lifelong treatment. It's very important to emphasize this.
I don't know, I'm just looking at the possibility of because our time though, but then let me just see, you can send in your messages now though. Just send in your message now, and then I'll read it out quickly. 081 717 56338. 081 717 56338. That's a WhatsApp number. And then 0700 903 903 903. Well, you could use that number to just call in, okay? And somebody is asking the question here. Have been treating infection, for a while now, but it persists. I don't know. Is it my fault? Is there something I'm doing wrongly, or what can I do? Is the question this person is asking? Yeah.
Okay.
What do I do?
But when you say infection is a broad topic.
That's what the person is saying.
So we have all sorts of infection. Is it a respiratory infection? Is it a urinary tract infection? Is it
Doctor, see when person tells you I get infection, the area.
type of infection that is
So no, I don't want to just stress my brain right now.
okay. So let's dwell on that path. So if it's that kind of infection you have, then you need to go for a proper diagnosis. And the best way to do that is to see a doctor and run the relevant tests. You will need to do some urine checks. You may need to do a urethral swab if you're having any discharge. You may need to do a urine culture. And based on those results, we'll be able to know the causative organism responsible for that particular infection. And the results of the culture would help the doctor, decide which medication is best for it. But without treatment, without going for this test, you would just be doing trial and error treatment. And if that's what you've been doing, you've just been trying random antibiotics without doing a test, you may not get the desired outcome. So until you know specifically and identify what the causative organism is, it may be difficult for you to appropriately treat this infection you're talking about. And the earlier you do it, the better, because recurrent infections or infections that are improperly treated have big complications, especially when it relates to fertility. So you don't want to take those things for granted.
Okay. Thank you so much, Doc. She sent a message earlier, last week, and I had wanted to just quickly read that message. I am actually looking for it. Okay. What has the genotype AA got to do with coming down with malaria frequently? Madam Florence, I think she sent that message earlier.
Okay, so we spoke about malaria last week, and malaria, we said is from the Anopheles mosquito, Plasmodium, infecting the red cells. So you have hemoglobin A, and you inherit each of the types of hemoglobin from both parents. So that's why you have some AA, some AS, some AC. So, but basically, AA is regarded as the stable form of hemoglobin. So you have a very stable red cell. So the ones that have the AS or the AC, they have a shorter lifespan. So because they have a shorter lifespan, they are cleared away from the system, at a faster rate than the A, because the A seems to be more stable. And the ones that have a high turnover of clearance, before the malaria parasite completes its life cycle, your body has cleared it out. So you may not have malaria, but because you have a stable form, the malaria parasite may have time to complete its cycle and then completely infect and show manifestations of malaria. So that's a simple way to explain it for you to understand. That's why people that have AA that live in the tropics or in a malaria endemic region tend to have a higher prevalence rate of malaria infection.
Now, I remember the question, I'm just looking at it. This is where we stopped the last time. Just to touch on it again. The difference between drug. You remember now? Yeah. The difference between drugs produced by different companies and are of different prices. You see, this malaria drug, when you use this one, is like, you find out this one is like 10,250. And then the same malaria drug again, another company, is 4,005. Is it that? Why is it like that?
Well, the truth is, different pharmaceutical companies, based on the research they've done and how big they are, and how and the level of professionalism in the production of their medication can influence the cost of the medication. For instance, some of the pharmaceutical companies are very high on research, and their research is on point. So they are always changing, the way they make their drugs, minimal impurities in their drugs, their packaging, all the process from manufacturing to delivery of the medication is top notch.
Right now, there are about 3 brands coming to my head right now. I wish I could mention. I don't want to give them free advice.
So they are not comparable to certain the same drugs produced by other companies,
Mm.
because when it comes to ethics of the profession and mode of operation or manufacturing and everything, there are different standards. So some are of extremely high standard, that they have zero or nearly zero impurities in their product,
Mm.
and they make sure that everything is standardized, and they do not negotiate or compromise standards at all. So everything is on point, and some of them are international companies, and because of the exchange rate also, you cannot compare the prices of foreign drugs, made by foreign pharmaceutical companies, to the ones that are locally made, because the foreign exchange and all that too would also influence the cost of the medications. But we normally tell people that, please don't self-medicate. So don't even be in a situation where you are bothering your head, which brand should I get? Your doctor knows best. That is why they are your medical professionals. That's why they are your health professionals. Go to them when you need help. They know what is best for you. If they think you need a drug that is from a certain pharmaceutical company, they would recommend it. But also another factor is the wallet or the pocket of the buyer or the consumer. The doctor too considers a lot of
Okay.
things when prescribing medications, because you don't want to give somebody a drug that he may not be able to afford or maintain, especially for people who are on long-term medications like high blood pressure drugs or
Okay.
diabetic drugs.
Okay.
So you want to make sure that it's something that is sustainable and something that is easily accessible to them, because some of our pharmaceutical companies that are really good have left the country already. Some of them, we can't mention their names, but they are no more in the country. So getting their drugs,
Okay.
if you find any, would be extremely expensive.
Someone is saying I have he has hernia and doesn't have the money to go for an operation immediately. What can be done?
A hernia, you will need it's always a surgical repair. You don't have a medical treatment. There are no drugs to correct your hernia, because your hernia is a protrusion of a viscous through an opening or a defect in the abdominal wall. Depending on where the hernia is, maybe it's in the umbilicus, the navel, or in the groin area, which is the inguinal hernia. But whichever it is, you should not waste time, because it can get strangulated. If you have a strangulated hernia, that is an emergency, because the loop of bowel may become gangrenous when blood supply is cut off from there, and it can be excruciatingly painful. So you don't want to go through that. While it is still uncomplicated now, it is the best time for you to seek surgical help. And you can go to a good general hospital or a good teaching hospital, have it evaluated, and I'm sure the cost of surgery there won't be as expensive as it will be in some private settings. It's important that the person gets the needed help quickly.
Okay. All right. Let's wrap things up now because of our time. Yeah, let's wrap things up. I always want people to, get the right information every day and every time. Get the right information as regards your health. It's very, very, very important. Okay, and that's why by next week we'll be coming up with something really good that will benefit everyone health-wise. Okay, yeah. I mean, let me leave it that way. It's going to benefit you health-wise, but then I might just want the doctor to give out his contact information, or because several questions here I might not be able to answer. Yeah. Thank you so much, Joe from Bariga. I appreciate that. I see your message. Thank you. So I might just want everyone to get to you. Get to